Hey everyone, I'm glad you're here. Say hi in the comments and let me know where you're watching from. So, today we're talking about a question that I hear every single year. Why does a zero premium Medicare Advantage plan often end up costing more? If you've ever chosen a plan because it looked expensive on the surface, then this session is for you. We haven't met yet. I'm Casey Album. I'm the Senior Medicare Advisor here at the Album Insurance Group. We're a 30-year plus family business. We're the family business that's behind Medicare, Medicare.com. And my job is to help people think beyond just picking a plan and instead build a Medicare strategy that fits into your life as you gracefully age. So here's the big idea for today. Zero premium is not the same as zero cost. In fact, it's very far from it. So grab a cup of coffee or your favorite beverage and let's get into it. So today we're going to cover why zero premium Medicare Advantage plans are advertised so heavily. We're going to look at where the real costs often show up later, and they will show up. We're going to compare managed network based care versus freedom based care. And I'm also going to show you why Medigap or Medicare Supplement often costs a lot less over time. And finally, we're going to talk about why not all Medigap companies should be treated the same. So if you're ready to get going, type me in the comments. So let's start with why these plans are so popular. Medicare Advantage is an alternative way to get your Medicare benefits. You can get your Medicare benefits through Original Medicare Part A and B, with Medicare itself being the insurance, or you can opt for what's essentially called a Medicare replacement plan. It's Medicare Advantage. It's a private managed care plan provided by a private company with a 1 year contract for Medicare. These plans are advertised very heavily. In fact, a lot of people think that this is the only way to get their Medicare benefits. They think that they have to get them from an insurance company because there's so much advertising. I'm sure we've all seen Joe Namath on TV, right? But these plans are advertised heavily because, number one, the lower zero premium gets a lot of attention. These plans are really easy for the insurance companies to market because really you're not paying an additional premium in a lot of cases. You still have to pay your Part B premium, but they're getting paid from Medicare to take you out of the system and provide your Medicare benefits. They often include some extra benefits like maybe some dental or vision, maybe a gym membership. So these plans are easy to market. They also seem simple to compare to one another during the annual election period. But Advantage is managed network-based care, and it works well for some people. But what's often missed is this: the premium or the lack of a premium is only one small piece of the total overall cost. So if this is making sense so far, type yes in the comments. So zero premium sounds good. That's the part you see up front. Feels good when you sign up, but here's where many people feel it later. With network based managed care plans, the costs often show up later. Copays as you use care, especially when you go to see a specialist. Copays for things like an MRI, like an outpatient surgery. Daily copays of several $100s for, on average, anywhere between the first 5 to 10 days of an inpatient hospital stay. These plans are all different. So some plans might be a little less, some plans might be more. There's no real standardization. Each plan gets individually approved by Medicare, so the co-pays, the co-insurance, all of that is based on what the plan contracts with Medicare. These plans also have annual out-of-pocket maximums, so you have to pay co-pays, you have to pay co-insurance. Co-insurance is where you pay a percentage of the cost. Very common if you're undergoing chemotherapy treatments on one of these plans. You'll typically pay 20% of the cost of the service in network. That's the other thing is you've got networks of doctors that the plan is going to allow you to see. By the way, most people don't realize this. The doctors can leave the plan at any time during the year. You're limited to making changes during an enrollment period. So you're going to be dealing with that. The You're going to pay your copays and your coinsurance. We call this cost sharing. You're going to pay that until you reach a maximum out of pocket that resets every year. And that maximum out of pocket is the amount that you have to spend before your plan is going to cover 100% of your costs. So there are financial costs, but there's also some non-financial costs in terms of network restrictions, referrals, and another big one is what's called pre-approval for services. The insurance company gets to essentially approve and decide whether or not they're going to pay for a test or procedure. That's a big part of these plans because over 70% of procedures require pre-approvals. Great example, someone needs a knee surgery, doctor thinks you need it, they submit it to the plan for the approval, the plan comes back and says, we don't think it's medically necessary, we're only going to approve physical therapy or maybe some type of gel injections. That can happen on these kind of plans. And then that starts a whole appeal process and a lot of paperwork. So it's important if you're choosing one of these plans to look below the hood, read through the fine print, know what your costs are, and understand how network-based managed care coverage really works. Now, these type of costs really tend to matter more as people age and use healthcare more often. And think about it, statistically at least, we're going to need healthcare more often as we get older, and it's typically going to be more serious and more expensive, which is why I often say the cheapest plan on paper can be the most expensive plan in real life. So if you've ever been surprised by surprise medical costs, type me in the comments. And this is the piece that most people never hear. The difference between having a Medicare strategy and having a plan that fits your strategy versus just picking a plan. So what's the difference? Well, Medicare strategy means asking some serious questions. How do I want my healthcare to work? Do I want managed care, or do I want the freedom to have the most control over my healthcare decisions? How important is flexibility when it comes to the providers that I can see, especially as my health changes? Do I want predictable costs and limited out-of-pocket expenses as I move on into retirement? Or am I comfortable with variable, unpredictable costs that can change every year? These are all important questions to ask. Am I going to travel? Do I want a plan that's going to travel with me and have the peace of knowing that I'm going to be covered no matter where I am in the country? Or do I want to have a plan where I know I'm probably going to have to come back to the local area to get coverage in many cases? Those are all important questions. So Medicare Advantage is the one that most people talk about, but freedom-based care, also known as Medicare gap protection, or commonly known as a Medicare supplement plan, works very differently, because with these types of plans, there are no provider networks. You can see any doctor anywhere in the United States who accepts Medicare or go to any hospital. That's a significant amount of freedom, especially if you get a serious illness. It means there's no provider networks. You never have to deal with begging your primary care to get a referral. And you also don't have to worry about pre-approvals, because with freedom-based care, it works based on medical necessity. Original Medicare is the primary insurance, and that Medigap or Medicare supplement plan works with original Medicare to fill those gaps in coverage and give you the most protection against financial out-of-pocket expenses that could be really devastating in retirement. Nice thing about these plans too is they have predictable monthly premiums, but that means you've got very, very limited, very clearly defined out-of-pocket costs, and that's important. For many seniors, especially as they age, this is the strategy that actually ends up being a lot less stressful and a lot less expensive over time. In fact, the only real surprise when it comes to Medigap coverage is that with all of the different types of Medicare or Medicare supplement plans, Medigap is surprisingly more affordable than most people realize. So if predictable costs and flexibility matter to you, type value in the comments. Now, I hear what you're saying. Yes, Medigap usually has a higher monthly premium, and that's true. But what you're paying for is risk reduction, predictable costs that you can plan on, and fewer surprises. But the most important thing is you have more control over where you receive health care. And I think that's a big one, especially if you get something serious. I recently had one of my relatives was in the hospital, and we're getting ready for discharge, and the case manager came in, and we're trying to get physical therapy set up at home a couple times a week. And the case manager's like, well, it might take me a while to get things set up. And she's like, the insurance companies, they really don't approve anything. We've got to file, we've got to appeal it and submit all this paperwork. She's like, what insurance does he have? And we said, oh, he has original Medicare with a supplemental plan. Her whole countenance changed, big smile. She's like, oh, that won't take me long at all. She said, and all of the home health care agencies are going to jump at the chance to be able to provide his care. And that's because they know that they're going to get paid and they're not going to have to be dealing with all of those approvals and all of that red tape. Over time, especially for people who use healthcare regularly, Medigap often results in lower total out-of-pocket spending compared to managed care too, because with most Medigap plans, the out-of-pocket costs are very, very limited. In fact, on almost all Medigap plans, the amount of your annual premiums is typically less than half of what the average maximum out of pocket is for the year in network on most Medicare Advantage plans. And don't forget, on those plans, if they let you go out of network, the out of pocket limits can be super high, sometimes in excess of $10,000. That's why so many people want to move towards Medigap later, even if they didn't start there. And therein lies the dilemma. Medigap plans, when you're outside of your 6-month window of starting Part B, and there's a couple of other exceptions too, but that's the most common window. Your Medigap open enrollment period, as it's called, is a 6-month window from when you start Part B, where you're guaranteed issue. What does that mean? That means that you can get a Medigap plan no matter what kind of pre-existing health conditions you have. That company cannot refuse to sell you a plan inside that window. Different states have different rules. Some states have more flexibility when it comes to guaranteed issue. Some states like Connecticut and New York have year-round guaranteed issue. But as a general rule, it's within 6 months of starting Part B, unless your state has a different rule. And therein lies the dilemma, because if you don't sign up for a Medigap plan when you're eligible, and years later you start to have some claims, and you're starting to realize, like, oof, this Advantage plan really isn't working for me. I want to get that Medicare supplement plan. You might now be uninsurable. Last year during open enrollment, there were a number of PPO plans and Medicare Advantage plans that literally dropped people. And in those cases, those folks got a letter telling them that they had special guaranteed issue right to enroll in a Medicare supplement plan. And they essentially got a second bite of the apple. A lot of the folks that I talked to during the fall, they opted for a Medicare supplement plan when they had that second opportunity for many of the reasons that I just went over. So most people, they end up wanting to move towards Medigap later, even if they don't start there. Now, not all Medigap plans and companies are the same. And this is the part where even people that sign up at 65 know they want a Medicare supplement plan. This is where I see so many people get burned. And this is where experience matters. So once someone decides that they want to have a Medigap plan and that that's the right plan to fit into their Medicare strategy, the biggest mistake that I see people make is choosing a plan solely on price. There's a lot of things that matter more than the lowest premium. And Medigap plans are all standardized. So Plan G, for example, that's the most popular Medicare supplement plan. Plan G is going to offer you the exact same benefits, the exact same out-of-pocket costs, regardless of the company. But the companies are not the same. And this is where having a trusted guide, someone that can see things that aren't available to you as a member of the general public, can really, really help. One of the things that a good agent or broker is going to look at is not just the lowest premium, but he or she's going to look at and only recommend companies that have a history of stable premiums over time. And think about it. When you have a Medicare supplement plan, this is not a change every year type of plan like Advantage. This is a permanent plan. So, and again, you've got those underwriting rules that in many cases can make it less advantageous for you to switch. Different states do different pricing, but most of our clients keep their Medigap plans for life or for a significant period of time. And that means that a history of stable premiums over time is much more important than the lowest first year premium. The other thing that's important is the company's financial strength and their ratings with the financial agencies, AM Best and Standard & Poor's. A good agent is only going to work with companies that have top ratings. The third thing is the length of time offering Medicare supplement plans. You want to work with a company that's been offering Medicare supplement plans for at least 5 years or longer. We really want to see what their track record is. Another big one that people overlook, and this is one that surfaces a lot when it's too late, is the company's reputation for customer service. I mean, you want a company that's going to have a good reputation for customer service, a company that has US-based agents that are employees of the company. It's not a good idea to sign up with a company that uses offshore customer service or possibly has a third party helping with their customer service. It's just not a great experience. And this is something, again, a trusted agent or a trusted broker is going to understand the differences. And the last one to look at is what's called open or closed blocks of business. An open book of business is a plan that continues to take new people all the time. A closed book of business is one where they open the plan and they close it after a period of time and they don't allow any new people to enroll. Well, guess what happens? As that population in that plan ages, people leave, it becomes a smaller pool, which means that the costs are shared amongst a smaller group of people. What does that mean? It means less stable premiums. There are companies that, as part of their strategy, they open up a book of business and they offer a low, what we call a teaser rate. And it's really, really low compared to other companies offering the same plan. And 2-3 years down the road, they close that book of business. Well, if you're on that book of business and they open up a new book of business with maybe a child company, you can't just automatically switch. It's kind of like the cable company, right? Where the cable company, you're an existing customer, you're paying a high amount, and then for new customers, they're offering this super cool deal. It's similar to that, but it's different. You can't switch without essentially submitting a new application and starting all over, going through underwriting. Now you're a couple years older. So that's why having a trusted guide really matters. Someone who understands how these plans work, understands how different companies work, and really understands how things work long term, not just for today. And by the way, there are different types of Medicare supplement plans to fit every situation and every budget. So if you're trying to understand where your current plan really fits your life, if you're wondering whether your current plan fits your current Medicare strategy, or you're comparing options and just want clarity, my team and I would be honored to help. If you want to get in touch with us, you can call the office, 954-970-4760. You can visit MedicareQuotes.com/Facebook. You can request a callback, or you can actually schedule an appointment with us. We're a family business, and that means no pressure, just clear answers. And I'll make it even easier. If you want help, just type help in the comments, and we'll connect with you, and we'll take it from there. So now I want to go ahead and answer some of the common questions that people always ask. And if you've got questions, go ahead and drop them in the comments, and I'll get to as many as I can in the time we have. But the big one that I hear is Medicare Advantage really more expensive? I mean, that zero premium, how can it be more expensive? Well, over time, especially for people who use care regularly, it can be a lot more expensive. And there are financial out-of-pocket costs, yes. But there's also the cost in terms of network restrictions, referrals, prior approvals, appeals, and there's the cost of not being able to see the providers that you want. What happens if you have a primary care physician or maybe a specialist that you've been working with that they leave the network in the middle of the year and now you're scrambling to find another doctor? For someone like my mom, when she retired, she had some chronic conditions. They were managed, and she had some specialists that she had relationships with that had helped her manage those conditions. Would have been really difficult for her if she had an Advantage plan and those providers left the network and now she had to start from scratch. She has a Medicare supplement. She doesn't have to worry about that. So there's more to think of than just the monthly cost. There are costs that are not financial. And the other thing too, 1 in 2 men, 1 in 3 women in the United States are statistically expected to be diagnosed with cancer at some point. Those are not my statistics. Those are statistics that are published. If you're someone that's undergoing cancer treatments on a Medicare Advantage plan, you're undergoing chemotherapy, you're almost always going to be paying co-insurance, 20% of the cost of the treatments. Very well expect that you'll reach your maximum out of pocket very quickly. What happens if it's a December treatment that rolls over into January? Well, now it's going to reset 2 years in a row. So these are things that you need to think about as you're considering the plan. Why do so many people move from Advantage to Medigap later? Well, very simple. They want fewer restrictions. They want access to more providers. They want to retain control over their healthcare decisions, and they want more predictable costs, and they want their out-of-pocket expenses to be limited. Can I change Medigap companies later? Sometimes yes, sometimes no. The health and the timing matter. And again, this can vary depending on the state that you live in. But as a general rule, you're going to need to undergo medical underwriting. And if you've had some claims, that may prevent you from getting a plan or changing plans at that point. Why do Medigap premiums increase? And yes, Medigap premiums will increase. And that's another reason it's so important to have a trusted guide, somebody who can look at the different companies and see how they performed in the past. Medical inflation drives that, but also think about it. Medicare costs go up every year. The hospitalization deductible that these plans cover went up this year. It's $1,736 now. The daily coinsurance for hospitalization goes up. So Medicare supplement plans have to cover those things. So they're going to have to increase premiums to begin with. But then medical inflation, claims experience, all of that can impact costs too. Different companies are going to react to that in different ways, and different companies manage their business differently. That's why looking at a company's history can give us an indication of what premiums are going to look like in the future. And that's not to say that if a company has a history, going back to 2012 of 1.8% premium increases, that it's only going to go up 1.8% every year. That's not exactly how it works. It's not linear. It goes up and down. But even in a year where there might be a more significant increase, a company that has a history of stable premiums is much more likely to return to their historical performance than a company that doesn't. And that's where a trusted agent, someone like us, can really help with that. Does working with a guide matter? Yes, because Medicare decisions are made long-term, mistakes get expensive, and as an agent or broker, we have access to data and information that's not available to the general public. A good agent or a good broker, whether you work with us or someone else, is going to go over all of these things with you and make sure that the decision that you make is the best option for you for the long term. That's all the time that we have for today. So here's the takeaway. A zero premium plan is not the same as zero cost. The best Medicare decision isn't about the least expensive plan. It's about the plan that fits most closely into your Medicare strategy and the way that you want to live your life. And if you want help understanding your options, you can reach out to us at MedicareMedicareQuotes.com/Facebook, or you can call the office at 954-970-4760, or just drop help in the comments and we'll take care of the rest. Thanks for being here today. If this helped, feel free to watch the replay when we send it out, or even share it with someone else who might be comparing their Medicare options and has questions. And I'll see you next week right here at 3 p.m. for our next Medicare Live. Have a great day, everybody.